Hi, this is Paul Schlosser from the University of Queensland, and today I'll be talking about our work Head-worn displays for emergency medical services staff, properties of pre-hospital work, use cases and design considerations. My co-authors are Ben Matthews, Isaac Salisbury, Penelope Sanderson and Sass. So when we think about challenges in the pre-hospital environment, one thing that obviously comes to mind is care for the critically injured patient. But as we can see in this picture here, there are also other challenges, such as dark, confined and loud environments, which make communication difficult. Also, weather can change suddenly, and oftentimes it is difficult to establish communication with remote experts. Because of this, it was suggested that decision support systems for paramedics and emergency physicians should be developed. However, implementing those systems on handheld devices is not ideal because oftentimes you need your hands in the pre-hospital environment to treat the patient. So therefore, head-worn displays were proposed as an alternative to handheld devices to implement those decision support and information exchange systems, because head-worn displays can provide information in a continuous and heads-up way. Unfortunately, it is yet unclear which use cases would be most beneficial to EMS staff, and to address this question we conducted some field work with the crew of Rescue Helicopter 500 of Retrieval Services Queensland, with whom we collaborated for this work. We conducted a total of 12 interviews, some of which were remote and some of which were situated. Unfortunately, due to COVID-19, we could not accompany staff during missions, but we were able to observe 2 full days of training. So in this presentation, I would like to focus on one of the 3 main outcomes of our work, which is an analysis of information access and exchange strategies. So first, when I went into the field, I was really surprised how little the staff knows about the patient prior to arrival at the incident site. And this has 2 main reasons. First, only the aviation crew is briefed about the patient's condition and patient's location when the crew is tasked. And this is so that they can make a neutral decision about whether it's safe to fly to the incident site or whether maybe the weather is too bad. Then the clinical crew also learns about the patient's condition, but most information about the patient at this point of time is known by the local ambulance staff who are with the patient at the incident site. However, they are often so busy that they cannot share the information. So this means all the information about the patient is oftentimes learned when arriving at the incident site. And at this point, the crew of Rescue Helicopter 500 has to go into another mode and then start sharing information with the rest of the clinical system. One very important tool to share information is the situation report, during which the clinical coordinator gets informed about the patient. And the clinical coordinator is one person here in Queensland who supervises all aeromedical missions. Once we had learned about the crucial role of the SITREP, we started speculating about different head-worn display use cases that could support the SITREP together with staff. So we came up with the idea to transmit 360-degree video from the incident site to the clinical coordinator and potentially establish a back channel through augmented reality where the clinical coordinator could place markers on the patient's body, for example. Staff generally really liked the idea because this would give the clinical coordinator more direct access to the patient at the incident site, and they could instruct procedures very well if they can see the patient. However, staff was a bit concerned that clinical coordinators could over-control the scene, and they were afraid to be bound to the patient because the clinical coordinator wanted to see the patient. We also came up with some design considerations which are about the environment, cognition and workload, adaptability, collaboration and privacy. If you want to learn more about these design considerations and other head-worn display use cases for EMS, please consult our paper in the ACM Digital Library. Thank you very much for your attention and attending this SIGCHI presentation.